Epilepsy is an abnormal, sudden, excessive, uncontrolled electrical discharge of neurons within the brain that may result in alteration in consciousness, motor or sensory ability and/or behave. Or you can define epilepsy as a chronic condition that is characterized by recurrent seizures. So epilepsy can be or is described in two ways. First, the type of epilepsy and the type of seizure. So the type of epilepsy depends on the cause of epilepsy, and the type of seizure depends on what happens to the person during the seizure. Types of epileptic seizures: partial or focal epileptic seizures, generalized seizures, secondary generalized seizures. So epileptic seizures are always different from any other types of seizures because epileptic seizures always start in the brain unlike others. Note that the brain has two hemispheres, the left and right hemisphere. Each hemisphere consists of 4 lobes, and each lobe performs a specific function. Focal or partial seizures. In focal seizures, the seizure starts in and affects just part of the brain, sometimes called the focus of the seizures. It might affect a large part of one hemisphere or just a small area in one of the lobes. What happens during the seizure? Describe the part of the brain that has been altered. Under focal seizures, they are again classified into 2 groups, namely simple focal seizures and complex focal seizures. Simple focal seizures. A small part of one of the lobes of the brain is affected. The person is conscious, will usually know that something is happening and will remember the seizure afterwards. During the seizure, they may feel strange but not be able to describe the feeling afterwards. This may be upsetting or frustrating to them. Simple focal seizures are sometimes called warnings or auras because for some people, simple focal seizures develops into another type of seizure. Complex focal seizures. This affects a bigger part of one hemisphere of the brain. The person's consciousness is affected and they may be confused. They might make strange or repetitive movements that have no purpose, called automatism. If you speak loudly to them, they may think you are being aggressive and so they may react aggressively towards you. Complex focal seizures often happens in the temporal lobes but can happen in other parts of the brain. Generalized seizures affect both sides of the brain at once and happen without warning. The person will be unconscious except in myoclonic seizures, even if it's just for a few seconds. Under this category, you also have 5 types. This includes absence seizures, atonic or tonic seizures, myoclonic seizures, clonic seizures, tonic-clonic seizures. Absence seizures are more common in children than in adults and can happen very frequently. The person becomes unconscious for a short time. If they are walking, they may carry on walking. Atonic or tonic seizures, the person's muscles suddenly become stiff. If they are standing, they often fall, usually backwards, and may injure the back of their head. The seizures tend to be brief without warning. Myoclonic seizures. Myoclonic means muscle jerk. Muscle jerks are not always due to epilepsy. Myoclonic seizures are brief but can happen in clusters. Clonic seizures are convulsive seizures but the person's body does not go stiff at the start. Tonic-clonic seizures, the person becomes unconscious, the body goes stiff, they may cry out and may bite their tongue or jerk. The breathing might be affected and become difficult or sound noisy.